Let's take a few minutes and talk about the concept of preservation of muscle and strength. Today's focus is strength. Why is this important? Well, unfortunately, many factors in modern life have conspired to erode or damage or reduce the amount of muscle you have and thereby strength. And that over time has implications. It impairs your ability to be healthy because muscle is a big player in managing such things as inflammation, insulin resistance, and thereby blood glucose, blood sugar, hormones such as testosterone in males, your ability to navigate the world successfully and not be subject to falls, fractures, and frailty and loss of independence. And surprisingly, muscle mass and strength are major predictors of your health long term, freedom from those problems, and even longevity. It's become clear that people with greater muscle mass, and I'm not talking about bodybuilder muscle mass, I'm talking about preservation of youthful muscle that you ideally had in your 20s and 30s, but even that's not a good comparison because many people in their 20s and 30s are exposed to factors that have also impaired their muscle. And so, we're going to try to aim to maintain or improve or increase lean muscle mass, but strength. And today's focus is strength. What's going on in the modern world that has eroded the health of muscle? Well, many things. Insulin resistance, for instance. That is the body's inability to respond to insulin. That causes your pancreas to overproduce huge amounts of insulin. And that is a setup for numerous health conditions that are familiar to you. Type 2 diabetes, coronary disease, dementia, various cancers such as breast cancer, but also erosion or impairment of muscle. Insulin resistance impairs muscle. Insulin resistance goes hand in hand with inflammation, and that adds to the impairment or erosion of muscle. The more abdominal, visceral fat you have, a factor that drives insulin resistance, so it goes hand in hand with insulin resistance. The more abdominal visceral fat you have, that is fat that is in the abdominal compartment and circling abdominal organs, like intestines, liver, pancreas, and others. The more abdominal visceral fat you have, the more insulin resistant you are, yes, but also the more likely you are to develop something called ectopic fat. That is fat that gets deposited in other parts of the body, such as the heart, where it accelerates heart disease, or the hip or knee joints, where it accelerates the deterioration of joint cartilage and thereby arthritis, or the kidneys, where it can cause a high blood pressure and damage your kidneys, or the pancreas, where it can accelerate the conversion of a type 2 diabetic to an irreversible type 1 insulin-dependent diabetic. But one other form of ectopic fat is what's called myosteatosis, and that is deposition of fat in muscle. This becomes exceedingly common as we get older, especially beyond age 40 and 50, and into our 70s it becomes virtually the rule. Now when you have myosteatosis, it impairs muscle function and strength and adds to mortality. People with the more myosteatosis, fat infiltration of muscle, are expected to die younger also. So this has very serious implications. So one of the things you can track, so two things you can track: muscle mass, and that'll be a topic for future. We use either a bioimpedance device, a body composition scale, or if you have access, a DEXA scan to quantify muscle, and you can track it over time. But today let's talk about tracking strength. And there's a very easy way to track strength. And that's called, with this little device here, this is one I paid $7.99 for. Unfortunately, I bought it a couple of years ago when it was $7.99, and more recently, inflation and other factors, I've seen them more priced towards $17.99 to $25 or so. You can spend thousands of dollars for medical devices, but you don't have to. We don't have to be absolutely precise. We want to be more or less ballpark in our measurement of strength. And this is a very easy hand grip device, a so-called dynamometer. Now this is best as a proxy for upper body strength. Not the best for lower body strength. If you want that, that requires such things as measuring how much weight you can move with a leg extension and other leg exercises. But for today, just for simplicity, let's talk about this dynamometer. So it's very easy to use. So this device allows me to set it to my age, sex, and then I'm going to pull with my dominant, for me, my dominant hand is right hand. So I'm going to measure it in pounds. You can also measure in kilograms. And what we're going to do is in future, I'll be posting tables so that you can compare the amount of weight you pull on your dynamometer compared to other people. Now, that's not the best comparator because not everybody else is healthy, but it gives you some sense for where you fall. So let's see what I can pull. I just pulled 95 pounds, and I'll show you where that falls, but more importantly, where you can fall should you get a device like this. Now, you can test right arm, of course, if you're right dominant, left arm also, of course. Gives you an idea. So the issue is not grip strength per se, but grip strength as an index, a proxy for upper body strength. And the greater your upper body strength, the more likely you are to have a healthy life free of such things as falls, fractures, frailty, loss of independence, and even have an impact on how long your life is. So I'll be posting those graphs that you can compare your measurement to. Now, you can find these things online. Don't spend a lot of money. So it's like those red lights. You can buy a nice, beautiful red light lamp if you live in a northern climate and can't get exposed to sun during the winter. You can get a very nice one for less than $80, or certainly less than $100. You don't have to spend $3,000. I see people spending all kinds of money for these things. Likewise here, you don't have to spend thousands of dollars. You can spend just a few dollars. And then you can use this to track over time. So if you're engaged in strength training, exercise in any form, and by the way, I'm not advocating you going to the gym for an hour a day, 5 days a week. I'm talking about 15 minutes, maybe twice a week, and incorporating some strength movements. That is important, and just for you to track it so that as the years pass, you have a gauge of, in this case, strength, and if you're using bioimpedance to measure your lean muscle mass. Now, ways to amplify your muscle mass and strength beyond resistance training: not being insulin resistant, not having inflammation. Those two things are addressed by my programs. The diet we follow, no wheat, grains, or sugars, addressing common nutrient deficiencies, vitamin D, iodine, omega-3 fatty acids, magnesium, that synergize to minimize insulin resistance and inflammation. We address the microbiome because colonic dysbiosis, that is disrupted bowel flora confined to the colon, but even worse, SIBO, small intestinal bacterial overgrowth in the small intestine. Small intestine not accustomed to this, and when you have the invasion of fecal microbes, so-called proteobacteria, into the 24 feet of the small intestine, these microbes live and die rapidly. They die, shed their toxic compounds like endotoxin into the intestines and then into the bloodstream. That's called endotoxemia, a major factor in impairing muscle mass and muscle strength. So we address SIBO. If you don't know what I'm talking about, please see my other videos, my Define Health podcast, my thousands of blog posts, and my WilliamDavisMD.com. Of course, my books, Super Gut, and my newest book, Super Body, where I go deeper into these kinds of things. That is because, you know what's happening? Is people are focusing on weight loss using the wrong methods. That method could be a calorie-reduced diet. It could be a pharmaceutical, like a GLP-1 agonist. It could be a bariatric procedure. These are all methods of reducing your calorie intake. Drugs, for instance, reduce your interest in food, slow stomach emptying. Bariatric procedures reduce stomach volume, reduce calorie diets, of course, just reduce calorie intake. But all those result in a dramatic loss of muscle. And we now know from several large databases going back a decade or more. These are very large databases tracking people who've lost weight, such as the NIH's NHANES database, or the Western European EPIC Norfolk database, or the ASPRI database. There's numerous of these large databases tracking what happens to people when they lose weight, almost always by cutting calories. What happens to those people? They die several years younger than they should have. Why? Well, it's hard to establish cause in these kinds of observational trials, but it's very likely loss of muscle. Typically, when you lose weight by cutting calories, 25% of the weight lost is muscle. And we know, for instance, let's say a 250-pound male cuts his calories by whatever method, loses 25 pounds, 10% of his body weight, he's going to die several years younger. So maintaining muscle, whether it's during weight loss or any other time, very, very important. And by the way, those GLP agonist pharmaceutical drugs likewise cause dramatic loss of muscle. You can even see it on somebody with their sagging skin, skin flaps, loose skin flaps. You can see it on their face. It looks like they've aged. They may be thinner, of course, but they look like they aged 10 or 20 years because they lost facial fat and facial muscle. So this idea of the critical role of muscle has kind of come to a head in light of all the wild overuse and overenthusiasm for things like these GLP-1 agonist weight loss drugs. Now, we also address the microbiome, right? We reduce SIBO and endotoxemia. We also restore microbes that participate in the gut-brain axis. If you don't know what I'm talking about, you want to look back at my videos, my podcasts, my blog posts on Lactobacillus rhodori specifically, and some other factors. Collagen, another big player. There are things you can do to minimize muscle loss and restore youthful muscle, and you can track it, whether it's with bioimpedance muscle mass or with a dynamometer measuring your grip strength. And I'll talk much more about this as we get close to my new book launch. The new book is, of course, Super Body.